What is oncofertility? Oncofertility, O-N-C-O, plus the word fertility, stands for the field or the topic of freezing eggs or sperm before cancer treatment. Onco stands for anything having to do with cancer. So it is a hot topic because it's important to think about, or to have the opportunity to think about, freezing your eggs or sperm before you go through cancer treatment. And in the United States, this is considered standard of care. It's recommended that everyone of reproductive age who might not have finished their family or started their family who has cancer think about whether or not they want to preserve their fertility through egg or sperm freezing before they go through cancer treatment, often surgery, chemotherapy, radiation. And that's because the good news is we're doing a really great job with curing cancer, and a lot of people are cancer survivors, and the number of cancer survivors in this country is growing and growing and growing. It's in the millions. And cancer survivors do have much higher rates of infertility because often the radiation, the chemo, and the surgery can directly impact the number of eggs and sperm that you have, can directly impact the health and the function of the eggs and the sperm. And often cancer survivors may have to delay childbearing and also experience age-related infertility because they have to wait until their cancer is cured. So often people who undergo chemotherapy or radiation are often told by their oncologist or their cancer doctors to wait 2 to 5 years, sometimes even longer, before conceiving, especially women, before conceiving, in order to make sure that they're safe and they're cured from cancer and they're finished their treatment before they actually go through a pregnancy. It's an important topic, and oncofertility really is essentially in vitro fertilization. So when we freeze sperm and eggs, it's usually done by reproductive endocrinologists or IVF doctors, and freezing sperm is most commonly done by sperm banks, and egg freezing is the first part of the in vitro fertilization cycle. So it's done by reproductive endocrinologists, where you take fertility drugs, so you make more than one egg instead of your usual single egg. So you take small injections that don't cause a lot in the way of side effects, and you do that for 6 to 10 days, and then you go to sleep for 10 minutes. You get an IV, you're totally asleep, you get a small needle that goes through the top of the vagina, one on the right side, one on the left side for each ovary. They pull the eggs out. After the procedure is done, 10 minutes later, you wake up, you're a little bit sore, you go home. Hopefully they will be able to freeze or put a bunch of eggs in the freezer. And those frozen eggs can keep forever. They're frozen via a technology called vitrification, with a V, vitrification, vitrification, which is this amazing technology that's like pressing the pause button. So if we take your eggs out when you're 29 years old, those eggs behave like 29-year-old eggs. So when you're 40, if you use those 29-year-old eggs, you have the risks for miscarriage and the risk for Down syndrome of a 29-year-old, not a 40-year-old. So it's a phenomenal technology, and it's been very, very helpful for helping cancer survivors have families later. Now, freezing your eggs is not a guarantee that you will have a baby, but it definitely can make a difference because there are many cancer survivors who might actually go through menopause from their chemotherapy or radiation, and therefore they're making no eggs at all. So having some frozen eggs can often mean the difference between having your own biologic child or not. Now, people who don't freeze their eggs, or where the frozen eggs don't work, still have the option to consider egg donation or adoption or child-free. So that's not the only choice, and not everybody who has cancer, who wants children, will necessarily want to freeze their eggs. But the important thing is to have the conversation, to talk with a specialist, to talk with a reproductive endocrinologist about what it would mean. And because insurance coverage is fairly poor in the United States, and most people do not have IVF coverage, Oncofertility or egg freezing especially is not often covered. Sperm freezing is usually much less expensive. And so even if you don't have coverage for that, that usually is much more affordable than egg freezing. But egg freezing can cost thousands of dollars if you don't have coverage. And so a lot of top programs and pharmaceutical companies participate in programs to try to make these technologies accessible to cancer patients. So just because you don't have coverage, don't think that you cannot do it. There are a lot of programs, grant programs, not-for-profits, and IVF programs and pharmaceutical companies that are all offering discounted or free services to try to help cancer patients preserve their fertility. And it is a national recommendation by ASRM, American Society for Reproductive Medicine, and the American Society for Clinical Oncology, ASCO, that everybody who has cancer, who is of reproductive age, consider talking with somebody seriously about whether or not to preserve their fertility, whether or not to freeze your eggs or your sperm prior to treatment. So that's what I want you to know about Oncofertility. Have a great day.